Welcome to The Explainer. Today, we're diving into a story that might just rewrite what you think you know about medical history. It's an incredible tale of surgical genius from thousands of years ago, a story that was almost completely lost to time. Let's get into it. So, let me ask you a question. When you hear the father of surgery, what's the first name that pops into your head? For most of us, we're probably picturing someone from ancient Greece, right? Or maybe a pioneering doctor from the European Renaissance. And yeah, that's the standard story we all learn. A narrative that usually starts with figures like Hippocrates and kind of suggests that really complex surgery is only a few hundred years old. It's a familiar picture, but as we're about to find out, it is definitely not the complete picture. What if I told you the true pioneer lived way back in the 7th century BCE, and that he was performing procedures so advanced they wouldn't be seen in the Western world for more than 2,000 years? This isn't just some historical fun fact. This really forces us to rethink where modern medicine actually comes from. So let's talk about the other father of medicine. It's time to meet Sushruta and his incredible surgical masterpiece, the Sushruta Samhita. This is the man himself, Sushruta. He was an ancient Indian surgeon, and his work, the Sushruta Samhita, is one of the foundational texts of Ayurveda. That's the traditional Indian system of medicine. And while he was a master of many things, it's his absolutely mind-blowing reconstructive techniques that earned him the title Father of Plastic Surgery. Now, this wasn't about aesthetics or vanity. In ancient India, cutting off someone's nose was a common punishment, so this surgery was essential. It was about restoring a person's dignity and their place in society. Okay. Ancient India's surgical wonders. We're really talking about a complete revolution in reconstructive, eye, and general surgery. Okay, you have to hear this. Let's walk through his most famous procedure, the forehead flap rhinoplasty, because it is just astonishingly modern. First, a leaf would be used to create a perfect template of the missing part of the nose. Simple, but brilliant. Then, and this is the genius part, a flap of skin is carefully sliced from the forehead, but it's left partially attached. Why? To maintain its blood supply. The new nose is then prepared, and that skin flap is sutured meticulously into place. And finally, hollow reeds are slipped into the nostrils so the patient can breathe, and the new nose holds its shape while it heals. I mean, come on, that is a remarkable multi-step surgical plan from over 2,600 years ago. Now, what's wild is how this ancient knowledge actually made it to the modern world. For centuries, this technique was a closely guarded secret, passed down within just a few surgical families in India. The rest of the world knew nothing about it until 1794, when an account was published in a London magazine. It described this exact procedure being performed in India. Well, that sparked a massive fascination in Europe. An English surgeon named Joseph Carpue spent the next 20 years practicing the technique on cadavers. Then finally, in 1814, he successfully performed it on 2 British officers. This shows a direct, unbroken line from ancient India straight to the birth of modern plastic surgery in the West. It's just incredible. But Sushruta's genius wasn't just limited to noses. Not by a long shot. The Samhita describes a whole arsenal of procedures. He detailed cataract surgery using a technique called couching, where a tiny needle was used to just push the cloudy lens out of the way. His methods for setting fractures, using traction, manipulation, and stabilization, are basically the same principles orthopedics uses today. He wrote about C-sections, removing bladder stones, even tracheostomies. And to do all this, he designed and classified 121 different surgical instruments, many of which are obvious ancestors to the tools in a modern operating room. So the big question is, how did he know all this? Well, this quote right here reveals his most revolutionary idea. At a time when cutting into a human body was a huge taboo, Sushruta insisted on it. He argued that you could only get real anatomical knowledge from direct observation. He even created a whole system for preparing a corpse for study. This wasn't just a technique, it was a total philosophical shift. It was the foundation for evidence-based medicine. Now, surgery was just one side of the coin. The other was internal medicine, or Kaya Chikitsa, which was laid out in another huge text, the Charaka Samhita. Its core idea is the Tri-dosha theory. This sees your health as a delicate balancing act between 3 fundamental energies called doshas. In this view, getting sick is just a sign that you're out of balance, and the whole point of treatment is to restore that balance through diet, herbs, and lifestyle changes. This table does a great job of showing the 2 different approaches. You have Sushruta, who's super practical, procedural, and focused on fixing the immediate physical problem. Then you have Karaka, who's more philosophical, seeing the body as a little universe and focusing on preventing illness in the first place. They even disagreed on some core ideas. While Charaka had his 3 doshas, Sushruta argued that blood, or rakta, was a 4th essential principle. This just goes to show that ancient Indian medicine wasn't some rigid, single belief system. It was a dynamic field with real debate and innovation going on.
A legacy interrupted. So you have to ask, if this medical system was so incredibly advanced, why on earth was it forgotten?
Well, it seems to have happened in stages. Around 1200 CE, invasions led to the loss of ancient texts, and different medical traditions began to merge into new systems. But the biggest blow really came during British colonial rule in the 19th century. The colonial government actively suppressed traditional Indian medicine, basically dismissing it as unscientific. They cut funding, shut down schools, and sometimes even made it illegal to practice. This systematic pressure pushed Ayurveda to the very fringes of society, where it only survived in quiet, rural areas and through secret family traditions, reclaiming a lost science. But thankfully, the story doesn't end there. The 20th century saw a powerful, modern revival. The real turning point came in 1947. With India's independence, the new government officially recognized Ayurveda, which opened the door for its modern comeback. And this wasn't just a symbolic gesture. It led to new colleges, hospitals, and government departments, all dedicated to studying, standardizing, and promoting this ancient system. A huge part of this revival is trying to bridge the gap with modern science. And as you can see here, there are a lot of clinical trials happening right now, often with India's top medical and scientific institutions. They're looking at Ayurvedic treatments for everything from ovarian cancer and Parkinson's disease to ADHD, using the same rigorous methods as modern medicine to see what really works. Ancient wisdom, modern challenges. But as you can imagine, this path to integration is definitely not a simple one. And that's really the big question here, isn't it? Can a system that was developed thousands of years ago fit neatly with modern biomedicine? Well, trying to make that happen brings up some pretty serious concerns. One of the biggest hurdles is safety. This quote points to a major issue. Some traditional Ayurvedic formulas intentionally include heavy metals like lead and mercury. Now, traditional practitioners have methods they claim detoxify these metals, but modern scientific analysis shows they can still pose a huge public health risk. This is a critical conflict between an ancient practice and modern toxicology that has to be addressed. So ultimately, the path forward is pretty clear. It's all about good science. To be credible in the modern world, this ancient system needs rigorous, transparent, peer-reviewed research to prove what's safe and what's effective. The goal isn't to replace modern medicine, but to figure out where this ancient wisdom can be integrated safely and effectively. You know, when we look back, Sushruta's legacy is so much more than just a cool historical footnote. His insistence on direct observation, his careful preparation, his focus on hygiene, his holistic view of the patient, these are timeless principles. They continue to inspire and inform medicine to this day. He reminds us that true patient-centered care has deep, deep roots. And that kind of brings us to a final thought. The story of Sushruta is such a powerful reminder that our modern way of understanding things isn't the only way. It really makes you wonder, what other incredible knowledge from our diverse global past is just sitting there waiting to be rediscovered? And how could it reshape our future?